Jackie Blake. She's a 30-year-old white female that was admitted to the hospital yesterday with the chief complaint of generalized weakness, the shakes, feelings of burning up, palpitations, intermittent chest pain, shortness of breath, and swelling of her feet. Jackie's symptoms have worsened lately. She has been anxious, forgetful, and confused. She has frequent diarrhea and numbness and tingling in her hands and feet. She reports no period in the last 4 months and has lost 15.5 pounds over the past few months. Despite a ravenous appetite, Jackie feels like her eyes are protruding and frequently has tearing, pain, double vision, light sensitivity, and Jackie stated that she takes her PTU only 1 or 2 times a day because she forgets to take it and thinks it causes her diarrhea and itching. She denies a sore throat or joint pain. Jackie is allergic to cephalexin and reports rash when she takes it in the past. Jackie's current medication includes PTU, 200 milligrams every 6 hours, which she reports she takes sporadically, vitamin B12, 100 micrograms IM every month, but she has not received in the past 8 months, pseudoephedrine, 60 milligrams as needed for nasal congestion, diphenhydramine, 25 milligrams, 2 at bedtime as needed for insomnia, and a trifisol, 1 tablet daily.
Hi Jackie, I'm your nurse today. My name is Katie. I'm going to do a quick assessment on you. Would you mind stepping out of the room?
Why? Did you tell her to do this? Really?
Hi Jackie, I'm Katie. I'm your nurse. I'm going to get some medical and family history on you. Is that okay?
Mm-hmm. Jackie tells her nurse she was diagnosed with Graves' disease 2 years ago, complicated by ophthalmic symptoms, pretibial myxedema, and pernicious anemia. She was started on PTU, 200 milligrams every 6 hours, and vitamin B12 shots. 9 months ago, Jackie was hospitalized with a thyroid storm, secondary to non-adherence with prescribed therapy. Her symptoms were controlled, and PTU and vitamin B12 injections were restarted. Jackie failed to follow up with her physician until now. She has been treated for anxiety in the past, and she has no family history of anything but her grandmother being diagnosed with Graves' disease. Jackie is a non-smoker, but drinks 2 to 4 beers intermittently when she becomes anxious. She lives with her fiancé. Their wedding has been on and off again for the past 2 years, and the date is set 6 months from now. During Jackie's physical examination, she was found to be thin, tremulous, anxious, restless, and in apparent respiratory distress. Jackie's blood pressure was 160 over 98. Her heart rate was 110 beats per minute and irregular. Respirations were 28 breaths per minute, and her temperature was 30 degrees Celsius. Jackie is 5'7" and weighs 114 pounds. Upon physical assessment, Jackie's symptoms include thin, fine hair, positive lid lag and stare, bilateral exophthalmos, bruit in the right thyroid lobe, enlarged goiter, hyperactive bowel sounds, 2+ pitting edema bilaterally, positive pretibial myxedema, a 2B clonus, and bruising at various stages on her back, trunk, and wrists. Labs and diagnostic tests were ordered on Jackie. Her chest x-ray showed cardiomegaly, pulmonary edema, and 2 old rib fractures. Her ECG reported a heart rate of 110 to 120 beats per minute, AFib, and a positive left ventricular hypertrophy.